Good afternoon. Thank you so much for joining the webinar. We are so excited that you decided to spend your lunch with us, and we hope that you'll gain a lot of information from what we'll share. Um, if you all would mind, either in the chat box, if you could just let me know that the sound quality is good, that would be great. Someone could just shoot me a message there. Thank you. Awesome. So again, thanks so much for joining the webinar. My name is Micah Whitfield, and I'm the Director of Programs here with Healthy Mothers, Healthy Babies Coalition of Georgia. And you should be seeing my screen. Let me just double check that really quick. Excuse me. Perfect. And so myself and two of my colleagues will share a little bit about the research we've done around prenatal education, as well as a toolkit that we've created to help ensure that pregnant and postpartum women across the state are getting this valuable information. So again, what's missing, exploring and responding to gaps in prenatal education across the state. So our mission as an organization is to improve maternal and infant health in Georgia through advocacy, education, and access to vital resources. If you're not familiar already with the work that we do. And so we do that through three pillars of our work. Again, resource access. This is basically our call center. We operate the Georgia Family Health Line, Children's First, Help Me Grow Georgia, and Prevent Child Abuse Helpline so that we can connect callers across the state to a ton of different resources. We also do advocacy. We started out as an advocacy organization and continue that to this day. And you'll actually hear from our research and policy analyst, Amber Mack. She's one of our presenters today. But our advocacy work, she's normally down at the Capitol, so she took a break today to join us here for this webinar. But that's really important to the work that we do. And then finally, education. And so this is our wheelhouse, that kind of our prenatal education, a lot of our capacity building, even for providers and for prenatal educators and those that do this work across the state kind of falls under this. So these are the three pillars of our work. If you're not already connected or know the work that we do, please feel free to reach out, and I'd love to chat with you and kind of connect you to one of these three. So as I mentioned, our presenters today are Amber Mack, who is our research and policy analyst, and she'll introduce herself a little bit more and tell you about her role here. And our next presenter is Sarah DiGiambo. I totally butchered her name, but she is amazing. One of our research assistants, as well as a MPH student and master's in nursing student as well, that has helped out a ton with this project, and she'll also chime in. So just to kind of start it off, to give some background on why we began this work. We had conducted a review of prenatal education across the state. Initially, we had started out maybe in 2016 or 17, just looking at the Augusta perinatal region because there were so many labor and delivery closures and hospital closures in that area, and we were doing some in-person prenatal education classes. But what we wanted to see was, where were these moms going for prenatal education? How are they accessing care? That sort of thing. And what we found there was that very little women were getting that education piece. And so then we went and looked at the entire state and wanted to see if it looked the same throughout the state, and if providers were sending their women to prenatal education. And if they were, we followed up with those prenatal educators and those workshops in the community to see what types of curriculum was being offered and what type of topics were being offered. So one reason that this is important to us, because we know prenatal education has the ability to educate women on vital signs and symptoms, and really it increases their patient autonomy. When you know and you have that knowledge and you feel comfortable asking those questions, certainly will have an impact on your pregnancy. So we understand that this is one small piece of ensuring that our patients feel empowered and that our women feel ready to go into this new phase of their lives. So again, if you're interested in seeing that initial report, it is available on our website, HMHBGA.org. And so you can, it's under resources and referrals, and you'll see that this report here. And you can certainly click on that and download it. So again, a part of what we did with that, we wanted to assess the accessibility and scope of prenatal education in Georgia. We wanted to identify prenatal education providers to see what type of content and what was their format. We also asked providers, we surveyed a little over 200 providers to see if they had an interest in online prenatal education or if they would refer their patients to a mobile or online app. And then we went back and had focus groups with pregnant women and postpartum women as well to find out if they were interested in that and what they felt like they were missing from prenatal education, or why would they attend a prenatal education class, etc. So overall, 300 surveys were disseminated. So we did, providers were identified through propulsive sampling, and then if they provided prenatal care and or prenatal education, they would, and they were willing to complete a mail-in survey or online survey. So prenatal educators were identified the same way. A lot of them may have been referred to us from the provider's office, or we, again, just found them through online searches. And they also agreed to a phone survey to go over their curriculums and some of their evaluation practices. So just a little bit of overview of what we found is that we talked to we got information from 105 courses in the state. So what we found is that overwhelmingly topics like oral health were not being discussed, HIV and STI transmission, health insurance information, and we really felt like this was a big piece because we know that over 50% of the births in our state are covered by Medicaid, and oftentimes for the women that are using pregnancy Medicaid, they may not have previously had Medicaid prior to that. So this is their first time using the Medicaid benefit, and getting that information, it's really important, and also understanding how soon after pregnancy it goes away, and if there were any chronic health issues or that were discovered during that time, then that again leaves a gap in health information. So we thought that was very important to bring up, and we wanted to see if other educators were covering that. We also found that there was information missing around SNAP and WIC, again, which these are very helpful programs, nutrition programs, to ensure that our moms are eating the things that they need and that those resources are available and they should know about it, as well as planning for healthy babies. And we can talk a little bit more about planning for healthy babies later. So again, if you're interested specifically in seeing more of this work, that is available through download on our website. So again, some of the findings from our focus groups: women felt like having to drive to a class could be a disadvantage if you don't have a car or transportation. And so those were some of the issues they had, or barriers, of course, that they expressed of why they maybe had not attended a prenatal education class. They wanted to hear more information on birthing options, wanting to know more about water births or doulas, or having postpartum classes. And that's one thing we certainly heard a lot. Women wanted more information on postpartum, wanted more information on how to care for yourself after C-section. Many felt like they weren't prepared for C-section. So we took all this information in and wanted to create an online platform, which we'll talk about later, as well as tools for educators that are doing the work, and really try to incorporate their feedback into our work as much as possible. And finally, feedback that they gave around having an online or mobile app. This mom in particular liked knowing that she can access it when when she wanted to. So it kind of puts that back in her hand as a busy mom. So with that, I'm going to turn it over to Amber Mack, and she is going to talk about the toolkits that we created based on our findings. And later on in the presentation, you'll get a chance to see the actual toolkit, show you where to download that as well, and we'll go a little bit deeper into that.
Hello, everybody. So as Micah mentioned, I am Amber Mack. I'm the Research and Policy Analyst with Healthy Mothers, Healthy Babies. And so looking at the research that we were able to find from our evaluation of prenatal care throughout the state of Georgia, we found that there were 6 areas that were gaps in education that needed to be filled. So that includes cesarean sections, oral health and pregnancy, health insurance literacy, HIV and STI prevention, postpartum care, and cultural competency. So in order to do these toolkits in the right way, we made sure that we were able to hold focus groups to get their input on some of the things that we had already developed. So these focus groups included prenatal educators, lactation consultants and nurses, midwives, just so we can get a very well-rounded amount of feedback on what needed to be in a toolkit, what was missing from the toolkit, so that we can make it best for you all throughout the state. So we had focus groups in Augusta, Atlanta, Columbus, and we had one for Savannah, but because of the hurricane that was over Skype, but we were still able to get some feedback from that. So each section starts off with questions around just looking at how you are currently conducting prenatal education classes. So for cesarean sections, thinking about how you've been educating clients on cesarean sections and how do you think you can best prepare mothers for having a cesarean section. And we know that this is important because in 2017, our C-section rate was slightly higher than the national average, with 34.2 C-sections per 1,000 live births versus 32 at the national level. And it's also just important to keep in mind that we should be teaching about C-sections, whether it's planned or not. A lot of times we have the tendency to only focus on it if somebody in our class has a planned C-section, but given our slightly higher rate, it would be beneficial to do it regardless. So some of the topics that we included in this section included ways to reduce C-section risks, risks around surgical procedures, just in general, how to prepare for a C-section, family-centered or gentle cesarean sections, which is something that came up during our focus groups, just keeping in mind how to still initiate breastfeeding and do skin to skin, even if it's not considered a quote unquote natural birth, how to recover from a C-section, the possibility of having a vaginal birth after a C-section, and then just some of the common myths that we see around C-sections, like the fact that, your recovery is better, things like that, less pain. Our next section is oral health. So thinking about how you promote oral health care during pregnancy for classes and workshops. If you do, how do you talk about it? And then what your current understanding is of the safety of oral health care during pregnancy. And this is important just because we know that there's a correlation between the risk of poor oral health for pregnant women and the association with prematurity. So there are a lot of theories around it, but one is that just like with anything else, the inflammation in your gums can sometimes get into the bloodstream that can affect the growth of the baby and cause the baby to be born a little earlier. We also know that women that are covered by Medicaid in Georgia, only about 2 to 4% of them are using those dental benefits or getting a teeth cleaning during pregnancy, even though that is something that's covered under pregnancy Medicaid in the state. So just keeping in mind that it's very important to educate on healthy oral health behaviors. Some of the topics in that section include safety of oral health care during pregnancy. It is safe, especially in the first and second trimester, outside of anything that require anesthesia or surgical procedures. Also ways to find a dental home. So we have resources for how women can find the nearest dentist that takes their insurance in the state. And then lastly, a dental note from the doctor. So women will need a note. It's called a DMA 635 form that they need to take from their perinatal provider to their doctor, especially if they're covered by Medicaid, just to confirm that they're pregnant and that everything's okay to perform in terms of oral health care. And for those that are interested, we do have an oral health and pregnancy working group that is looking to increase utilization of oral health benefits for pregnant women covered by Medicaid. Our third section is health literacy and public benefits. So just thinking about how you're promoting health insurance literacy.
Just check out the sound. Someone said the connection is bad.
Oh, sorry.
Just ask them to check in.
If you're having issues with connections, please feel free to put that in the comment box. And if you can hear me okay, just let us know. Okay, cool. So just thinking in terms of health insurance, health literacy, and public benefits. So how you're promoting that during your classes and how you think that can best be incorporated with information for things like Planning for Healthy Babies and the WIC program. So this is important because we know in 2017, over half of the births in Georgia were delivered to women covered by Medicaid. So, you may think that everybody in your class may be covered by private insurance, but we know in Georgia that most likely, kind of just depending on the circumstances, they may be covered by Medicaid. So it's just important to empower clients to be able to navigate this complicated system. We know that the medical system can be a lot for people to tackle. So just being able to increase health literacy to ensure that your clients kind of can make informed decisions about their pregnancy and their care. So some topics to include are Right from the Start Medicaid. That is our pregnancy Medicaid in the state of Georgia. It covers women up to 220% of the federal poverty line, and that's full Medicaid and dental benefits. We also have those care management organizations or CMOs. So that's Peach State, AmeriGroup, WellCare, and CareSource. And those are the ones that operate and kind of are the payers on behalf of Medicaid. Then we have our Planning for Healthy Babies benefit, which is another Medicaid program, and it covers women up to the same 220% of the federal poverty limit. And that allows for women that are not pregnant and that are able to reproduce to get access to contraceptive care. And for those women that have a very low birth weight baby, they get some extra care with case management, dental benefits, and some basic medical care like primary care physicians. And then lastly, we have our special supplemental nutrition program or WIC, and that provides some nutrition and food access for women who may not otherwise have access. And we also have a working group on planning for healthy babies for those that are interested as well.
All right, so moving on to our section on HIV and STI prevention. So a couple of discussion questions we had here, just to think about are what types of educational materials do you use to teach STI, STD, and HIV prevention in your classes? And how have you tailored your teaching to clients who have STIs or STDs or HIV? All right, so we wanted to include this. We figured it was pretty important considering Georgia has the top 10 highest rates of congenital syphilis. 90% of HIV positive pregnant women received prenatal care. And just some topics that we wanted to include here are effects of STIs during pregnancy. We have a little table in the toolkit that goes over the effects for the mother and the baby. Being mindful of stigma, just if there are women in the classes who may have had STIs or STDs and what that might mean for them. Socially, culturally, and then the importance of screening. And I believe we included some of the time frames for screening. All right, and the next section, postpartum care. So what postpartum education handouts do you currently provide to clients? is one discussion question we included. And then how do you prepare women for the postpartum period during your prenatal education classes, workshops, or visits? All right. And we wanted to include this. One big reason is a majority of Georgia's pregnancy-related deaths occur in the postpartum period. So this is really a crucial time for women and prenatal educators to be aware of how women can best prevent problems from happening and know warning signs when a problem is happening. Women desired more information on postpartum care also when we conducted focus groups during the research. For the discussion question, sorry, just going back, you can drop any of the answers that you have into the chat boxes. So I think we have a couple more sections coming up with discussion questions. Going back to postpartum care, we have several topics here that we figured were important to include, a lot of which came from the focus groups that we had when we were getting edits for the toolkit. Right. Okay, so the next couple discussion questions. Do you have posters or brochures with people that are reflective of your service population? And do you take potential language differences into consideration for your classes? All right, so just to go over the definition we have here for cultural competency, it refers to the ability to work with individuals of different cultural backgrounds, taking into consideration one's race, ethnicity, national origin, language ability, socioeconomic status, familial status, sexual orientation, and gender identity. So really, culture isn't just about race, ethnicity. It really covers a broad spectrum of what makes people diverse. So important to consider the role of implicit bias and how this plays into maternal outcomes. So something that we included in the toolkit is an implicit bias test that prenatal educators can take just to see if they may have biases they're unaware of even. So that was something I found pretty interesting. And then topics to include here, it also covers a pretty broad spectrum, but class service accessibility. So for example, the timing of classes, some women may be working 9 to 5 or others work at night. So seeing how you can make, one can make that a little flexible, and then also costs of classes and child's care, and if children are allowed to classes, just some things to think about. Language action plans, cultural representation and understanding, respect of LGBTQ+ clients, health equity, and then client empowerment.
Sorry, 1 second. So we are super happy to announce some information about our Pickles and Ice Cream Georgia website. So as Micah mentioned earlier, one of the things that women expressed that they wanted was access to a web-based education service. So they prefer it in person, but for places that may be more rural or lack access to prenatal education classes, they said that they would be happy to have this as an alternative. So this will be a website launched by us to provide prenatal education for women throughout the state of Georgia. And so what kind of started this was the evaluation that we discussed. So knowing that 82 to 90% of women don't receive prenatal education outside of doctor's appointments. And we know that about 48 out of 50 states, Georgia has the highest maternal mortality rate in the country. And we know about half, so 79 of our 159 counties don't have access to obstetric care. And then when we talked to providers, 68% said that they would be happy to recommend their, and this is 68% out of 204. So majority said that they would be very likely to refer their patients to pickles and ice cream. So this is kind of what we're thinking about in terms of what the website will look like. So it'll have a blog, it'll have a section for moms and families, as well as educators and providers, and then ways that they can contact us or other providers if they need more information.
Awesome. And so pickles and ice cream should be ready for launch by May. And again, moms can go onto the site and get all of that quality prenatal education topics as well as down. We'll also have videos, like short animated videos on some of these same priority topics that are in the toolkit as well. But again, this is just focused for moms. So it'll be a really great resource that providers can also refer to, especially for moms that may not be getting that prenatal education. They may not have an opportunity to take them up on a referral at a local hospital for prenatal education, etc. These tabs here, this will be where educators can download the toolkit and providers as well. And then for moms and families, this will be additional information, like I said, on those topics, as well as a blog, quizzes, and different things for families. Okay, there's a bad echo. Thank you for telling us that. Okay, should be better now. Sorry about that. Basically, what I was sharing was that these tabs will be available for families to get that information, as well as providers and educators can download the toolkit and get that information. So I just want to take a second. Some of those discussion questions that we listed before on some of our priority topics. If you didn't get a chance to maybe put in the question box or in the chat box, if you're currently doing those things, how are you taking into account cultural competency when you're doing a prenatal education workshop or you're working with families? How are you including postpartum care? For example, in our prenatal education classes that we do, our in-person classes, AWAN has a wonderful post-birth warning signs sheet, and so we put that in every folder. So please share with us what things you're doing. I'll also share in the cesarean section as well. We shared this when we did focus groups with educators across the state, and there is actually, I believe, in Columbus that does a mock C-section day. So basically, pregnant women could come in and do their hospital tour, but they get the opportunity as well to go into the room is prepped like it would be for the OR. And they can get a chance to kind of go in to see if they had to have a C-section. This is kind of what to expect. And so, and again, a lot of that comes from the feedback that our moms are having a number of C-sections, but they are not prepared for that, and did not feel like they were prepared for the aftercare of it either. So again, all of these discussion questions, they're also included in the toolkit, but we'd love to hear from you if you want to put it in the questions or chat box, maybe some of the things that you're currently doing, and we would love to just kind of share from one another on that. If you're including any of these topics. So yeah, and then I also want to show you the actual toolkit. Give me just 1 second to pull it up here. Okay, so this will be available for download on the website as well. This is the toolkit, and you can literally go to those priority sections, and it talks about why the topic is important. Some data points are included, how to include it in your workshops. Now we understand that everyone, the format of their workshops are different, and you may not be able to cover all of these topics, but we want to ensure that if you can, and especially if it's something that the women that you're serving need this information, or they're asking for this information, that you have the tools to give it to them. And so it tells how to include, topics to include, resources and handouts, as well as discussion questions. So what I'd like to do is just kind of show you also the evaluation piece. So we currently do evaluation for our prenatal education classes at 2 weeks. So we'll follow up with them 2 weeks after the workshop just to see how they like it. That's more of a satisfaction piece. And then 3 months and 6 months. And we offer incentives for the 3 and 6 months, but as you can imagine, it is sometimes difficult to find our ladies at those marks. But believe it or not, our retention rates are pretty good. Now, everyone may not have the budget or the capacity to follow up in that manner, but we are able to see some really great outcomes when we do that. So we do a pre and post test. So we see that our moms are gaining more information, particularly in the areas of birth spacing, safe sleep practices, and HIV transmission. And we recently, this is from the report from last year, but like I said, we started adding in the AWA and post-birth warning signs into the pre and post test, so that they are knowledgeable on what to look for in their postpartum period. And we went back and forth on this because of course we didn't want to scare moms or anything like that, but we wanted to make sure that they had the information. And so that has also been an area of knowledge increase we've seen as well. Our 3-month surveys show that our moms are overwhelmingly talking to their providers about birth control. They're having, a good number of them are having vaginal deliveries and initiating breastfeeding, as well as at the 6-month mark, 100% of our participants had taken their babies to their newborn appointments, and 96%, which I think is really awesome, had visited their doctor for their postpartum check. So we know that the classes are working, and I'm sure if you do the work, you know that what you're doing is impactful, but it's really great when we're able to evaluate it. And that's one thing that we found when we were talking to a lot of the prenatal educators across the state, is that they really weren't doing the evaluation piece, and for whatever reason, and we totally understand that, but it really demonstrates the impact of the work, and that we need to make sure we're offering more classes for moms that fit their lives and their schedules. So I just want to go down a little bit more. So again, each section is included here. Everything that we briefly went over in the actual PowerPoint. And then, discussion questions for your classes that you can include. And then, sorry if we're going so fast, I'm going to show you exactly the evaluation piece. Hopefully your eyes are not rolling from all of this. Okay, here we go. So here we talk about the pre and post test, but we also give you an example of how to formulate your questions, as well as an example of a pre and post test that you could use. Oh, sorry. Example of a pre and post test that you can use, as well as our information to reach out to either myself or Amber, and getting feedback on putting your own pre and post test or your evaluation together. So certainly thinking of using us as a resource as well. Yeah, so I'm going to stop for a second and just take a look at some of the questions in the box. So many hospitals will not offer tours outside of Atlanta. Yeah, that's one thing that we had found as well. Like some hospitals are not doing that. And that can certainly be a barrier, especially as if you're an educator not working within the hospital setting, but you want to be able to tell if you're doing community-based prenatal education, for example, you want to be able to tell your clients what to expect at a certain hospital. So we certainly see the barrier to that. And if you're interested, I'd love to talk to you a little bit more on in terms of some of the things that our prenatal education working group is talking about in terms of getting around some of those issues. But we have encountered that as well. So we have another one. So Christine, hi Christine. Christine says she's a certified nurse midwife offering home birth services in Metro Atlanta and surrounding counties, birthed by Grace Midwifery, and a self-advocacy of focus for HMHB. Many cesareans and other issues procedures can be prevented as mothers gain confidence to advocate for themselves. Absolutely. That is certainly something that we talk about in our classes. However, we know that it's still happening, right? And so in our in-person prenatal education classes, we talk to moms about their birthing options, about all of them, about doula support, all of those things. And I think that it is certainly something that HMHB talks about in terms of self-advocacy for moms. But we also know that just from doing our research that cesareans are happening, and wanting our moms to be and our educators to be prepared for that as well. But I totally agree with you that self-advocacy is a really in birthing options and choices is really important. And then was there any discussion on how to find or determine reputable resources for perinatal education, for example, using resources based on evidence-based practice versus a blog that may not be? So thanks for that question, Brooke. I'm not sure if you're referring to the providers or to when we did our focus groups with the moms. So I'll kind of speak to both. And if I didn't answer your question clearly, feel free to shoot me another question or clarify. But basically, when we talk to providers and we ask them about their prenatal education referral practices, oftentimes they would just refer to whatever or whatever was the closest hospital that they were, wherever they had their delivering. Or I'm blinking, but wherever they delivered. And so that's normally where they would refer for prenatal education. Or they consider prenatal education just giving mom like some pamphlets in office, right? And so we certainly would not consider that prenatal education because, I mean, there's, a whole thing with adult learners, and we want to make sure women are able to get that information and ask those questions. So there wasn't a ton happening there. And so again, much why we want Pickles and Ice Cream to be a reputable resource for Georgia-based providers to share with their clients. And then in terms of moms, in our focus group, we put a number of like little pieces of paper with like avenues for education. So it could have, some of them included a book, a provider, your family, a blog, and so they had to pretty much order their, put in a level of order to which one they thought was the most reputable for information. And surprisingly, and many of our moms were within, I would say, 19 to 25. Surprisingly, overwhelmingly, providers and family were the top choices for where they wanted to get their education from. And so that also told us that if the providers are on board and the provider says, I want you to take this class, moms are really still listening to the providers. And things like social media or websites fell much further down the list. So that was surprising to us, but it also again kind of reinforced the importance of making sure that those resources are out there and that we have champions in those spaces providing that. So yeah, but I think you bring up a great point around making sure the resources are evidence-based and that sort of thing. Are the websites available in other languages? Currently, if you're speaking primarily to Pickles and Ice Cream, no, that is not. However, it's something that we do want to look at in the future. And then I see that you also put ICEA is a great resource. Yes, it is. We actually trained, we have a training program that trained 7 women that were interested in being certified as childbirth educators. So, and we used ICEA for that training program. So they are a great resource and a partner of ours. And we certainly share a lot of the information that they provide. And if you have, that was the last of my questions in the box, but if you have additional questions, or if you'd like to share any of feedback, if you yourself teach classes, and you'd like to share, you know, some of your answers to the discussion questions, we'd love to jump on that. Or if you have any specific questions for our co-presenters as well. Are the slides from this presentation available to print? Yes. So we will send out the slides, a link to the toolkit, as well as a survey for you all to after the webinar. So it'll probably, the survey will probably take about a day or so, and then everyone that's present will receive that. And then this presentation is also available for one nursing CE. So once you complete the survey, we'll follow up with you to get you a certificate for that as well. But yes, all the slides will be available as well as the toolkit. Awesome, yes. So thank you. You all are very welcome. Great. So I guess we have just a few questions too that I'll throw out to our co-presenters. And then again, if as we use our last few minutes, if anything comes up for you all, we'll be happy to answer them. Oh, and one comment from Elise. Hi, Elise. All HMHB sites have Google Translate. Oh, didn't know that. So yes, they are available for translation. So as Sarah, for you, as you were conducting the focus groups with prenatal educators putting this together, what were some of the themes and things that you saw that you feel would be important to share with our audience?
What comes to mind first is for the cesarean section of the toolkit. A lot of the prenatal educators had recommended us putting the VBACs in there. That was something we didn't have in there before. So vaginal birth after a cesarean. Something else, postpartum doulas. That was something we didn't have in there before the focus group. So I think we in the toolkit we have a resource where one can find a postpartum doula. Trying to think of what else.
Yeah, I know that VBAC piece was really important.
I think every focus group had mentioned the VBAC.
Yeah. Yeah, and I think that kind of goes back to the options piece, that our moms want options, and we, you know, kind of as the information bearer holders, making sure that we're providing that. Yeah. Amber, for you, what are some ways prenatal education or care can be advocated? Like how can, what, from an advocacy standpoint, if our folks that are listening now say, hey, you know, I went through the toolkit, I like everything that you're doing, like what's the next step in terms of advocacy?
I think we are in our legislative session through the beginning of April. It started January 13th. And I think one of the ways that we can advocate is by ensuring that money or funds are kept. There were a lot of initiatives that the General Assembly funded over the past 2 or 3 years, and we're really grateful for that. But there has been a call for state agency level budget cuts. So, for example, we secured secured funds to establish 3 perinatal satellite centers in Meriwether, Randolph, and Wilcox counties. And so we wanted to ensure that the funds for that are maintained. There have also been some funds to ensure that Morehouse has a center of excellence on maternal mortality. So things like that, just keeping in mind if you're having discussions with your legislators, just letting them know, hey, these are the things that we feel can protect prenatal education and care throughout the state. And then just going back to the point of the fact that almost half of our counties do not have obstetric care. So just finding alternative routes for that. One of the biggest things that we're advocating for this session is extending Medicaid to a year postpartum, so that right from the start, Medicaid that I mentioned earlier, right now it cuts off after 60 days, but we know as health professionals that, women need care beyond that 60-day period, whether it be physical care or mental health care. So ensuring that women have continued access to that. So that's one of the biggest things that we're fighting for as well. So if you need more information on that, please feel free to reach out to myself.
Awesome. Thank you so much. And let me make sure I have your contact information listed here. There we go. Awesome. So I had 2 other questions pop in. This is from Tracy. Hi, Tracy. Tracy's one of our former doula graduates. So Tracy, I'm sorry, she is a childbirth educator graduate. My apologies, with ICEA. And she says, hey, Micah, just wanted to say that I'm working with a woman who is aiming for a VBAC delivery. So hearing about this resource is extremely useful from a childbirth educator's point of view. Awesome. I'm happy to know that it's useful. And then Anna says, does Georgia offer a program for parents called PEPS? Not that I know of. The program, only thing I can think of that may be similar to that, I've never heard of PEPS, but we have the program called Parents as Teachers. You said Program for Early Parent Support. I don't think so. But there is a program called Parents as Teachers, and they're typically at the county level. So I know, for example, at Fulton County, we work a lot with their Parents as Teachers program, and we do our prenatal education classes with them and work with their facilitators to kind of incorporate that information. So I think there may be something similar, but if you want to email me directly, we can figure out exactly where some overlap may be there. Great. Well, again, one more question. Great. What about family planning? I heard it mentioned. Yes. We found that because it's not necessarily listed in the toolkit, but other than planning for healthy babies. So we do talk about that program because it is extremely important to make sure moms are getting connected to that program, and some advocacy work that we're doing as an organization so that moms can get that benefit for family planning. However, the links are there, and for educators, they can get more information on how to tell families about the program and how to get them connected to it. There was another question. I noted when teaching, hi Margie. I noted when teaching for HMHB that addressing doula support was met with interest, but low income status prevented engaging in doula. What can be done? That is another great question. Again, as I mentioned earlier, we have a doula training program, but we also have a doula work group, a doula access work group that which is a part of our advocacy work. And so we gather advocates and doulas and folks that are doing this work and interested in this work to figure out how we can ensure, particularly moms that have the fewest resources, how they can get a doula. So I will let Amber just share a little bit about our doula access work group and what we're doing from that standpoint in terms of getting doula access for more women. And thank you for that question, Margie.
So yes, we do have our doula access working group, which meets on a quarterly basis, and they focus on 3 main areas. So reimbursement pathways, whether that be through private insurance or Medicaid, just finding ways to get doulas paid at a fair rate. One of the strategies under that is DPH's, or the Department of Public Health in Georgia, is starting a community health worker curriculum program. So we're looking to get doulas incorporated in that as perinatal community health workers, so that way they are able to be reimbursed, because that's kind of the path that DPH is looking into doing. We also have a hospital buy-in focus area, so that's looking at incorporating a doula program on a hospital level. So finding some community champions or medical professional champions that can assist with that. And then lastly is research. As you mentioned, there's not a lot out there about the availability of doulas in Georgia, as well as kind of what they're asking for, who can do sliding fee, or who may do some pro bono community work as it relates to doula care. So that's what our research arm is for, just to kind of delve into some Georgia-based research around doulas.
Thanks, Amber. And I also wanted to also plug that with our satellite centers that Amber discussed earlier, part of that we would also do training for doulas. So similar to the program we do here in the Atlanta metro area, we would also do provide doula trainings and certification opportunities through Dona International there as well, in those counties and those surrounding counties. So that's another way, just in terms of programming, that we are trying to ensure that more women throughout the state have access to doulas. This is another question that I think would be good for Amber to answer. Would family planning be included in Medicaid extension?
So yes, family planning would be included in Medicaid extension, because that pregnancy Medicaid is full service medical care. So anything that anybody that's covered under general Medicaid in the state of Georgia, they would also be covered for with that extension. So that would include access to long-acting reversible contraceptives, family planning counseling, things like that.
So I know I've got several other questions in queue, and I love all the questions. I will try to email you directly back. I know we are about at the hour, so please be on the lookout for the survey link that'll be sent, a link to the actual toolkit. And again, if you're interested for nursing CE as well, that will be available as well. And so we thank you again for all the great questions, for showing up. It always lets us know that, that the work we do is important, and that we know prenatal education is a great tool for empowering our moms, and that we have other avenues to work toward, of course, to make sure that we're serving our women throughout our state. But we thank you for your interest, and I will get that out to you within the day. And thank you to our co-presenters for doing this work with me, and also for sharing this afternoon. So that's it. Have a great afternoon.